So today I'm going to talk about the Diploma of Membership of the Faculty of Dental Surgery of the Royal College of Surgeons of England. I'd first like to introduce myself. So I'm Dr. Caroline Harvey. I'm a specialist in oral surgery. I take a great interest in postgraduate dental education, and I work as the Associate Dean for Dental Core Training down in the Southwest. I've been an examiner for the MJDF exam since 2009, and I'm the development lead for the new MFDS exam at the Royal College of Surgeons of England. So what I'd like to talk to you about today is, what is the MFDS? Why should you take it? When will you take it? How to take it? Where to take it? And I'd then talk about some of the benefits of being a member of the Royal College of Surgeons of England. So what is the MFDS exam? So it's a postgraduate diploma which has been introduced to replace the membership of the Joint Dental Faculties Examinations, otherwise known as the MJDF. So this has been introduced because the MJDF, as the name would suggest, was a joint exam between the Faculty of General Dental Practitioners and the Faculty of the Dental Surgery of the Royal College of Surgeons of England. However, the Faculty of General Dental Practitioners have decided to leave the Faculty of Dental Surgery and become an independent professional body. So this has opened up the opportunity for the Faculty of General Dental Surgery to have its own MFDS, which is a new exam. The MFDS does exist in the Scottish surgical colleges, but this is a new exam for the English college. So what exactly is the MFDS exam? Well, it's an exam that's aimed at those dental graduates who have completed 2 years of foundation stroke basic dental training. So if you've done your foundation year and possibly a year in dental practice or a year as a dental core trainee 1. And it demonstrates an attainment of a level of knowledge, understanding and clinical competence above that of the primary BDS dental qualification. And it provides evidence of a commitment to further professional development, which will help you progress in your career as a general practitioner or if you decide to specialise. And why should you take the MFDS exam? Well, if you want to do dental core training and/or specialist dental training, then whilst it's not an essential requirement, it is a desirable requirement to have your MFDS qualification. And certainly the people that you'll be competing against for these jobs are most likely to have the exam. If you're thinking of entering medical school, if you wish to pursue a career in oral and maxillofacial surgery, then having the MFDS at the time of entry to medical school will provide evidence of your commitment to postgraduate learning and qualification. It will enhance your job prospects if you're applying for jobs in practice. It looks good on your CV, and your patients will be impressed if you have these letters after your name. And importantly, if you don't know what to do, it keeps your options open. So this is just a slide demonstrating the career pathway in dentistry. So when you first qualify with your BDS after years of study at school and university, it may be tempting to think, oh, that's it, that's all the exams you're going to ever do. But really, it's important to realise that you're just entering a lifelong journey of education. After your BDS, you'll be doing your dental foundation training. Some of you may be entering into a 2-year longitudinal post. Most of you will be going into a 1-year dental foundation post and then possibly going on to dental core training. And it's advisable at this stage, 2 to 3 years after qualification, to have obtained your MFDS exam. You may then decide to go to further dental core trainings and specialty training, which may take you into an academic consultant post or a clinical consultant post. So this slide just demonstrates the number of trainees per year. So we have approximately 1,000 dental graduates that will be entering dental foundation each year. And of those, 650 will be exiting the training pyramid and they'll be going into general dental practice, salaried dental services or the armed forces. We'll have approximately 4 people competing at dental core training year 1, 180 will go into DC2, 110 into DCT3, and approximately 100 people will be going into dental specialty training. But the important thing to take away from this slide is that each level that you go up, you'll have a competitive selection, and it's very important that you can maximise your benefits by having the MDF at this stage. So when can you take the MFDS exam? So the part 1 can be taken as soon as you've passed BDS, and the exam times tend to be in October, November and March, April. For part 2, obviously you have to have passed your part 1 MFDS, and you have to have completed a minimum of 12 months of full-time postgraduate clinical dentistry, or if you're working part-time, you have to have completed 12 months within a 3.5-year period. Although you may have passed your MFDS after 12 months, you won't actually be awarded it until you have completed 8 months of full-time postgraduate clinical dentistry. And the times of the exams tend to be in November and March each year. So part 2 MFDS must be completed within 5 years of passing part 1 MFDS, and you have 4 attempts at part 2 are allowed. So what level does the MFDS test? Well, it's testing 2 years after primary qualification. And the syllabus is based upon the curriculum for dental foundation training and the UK Dental Core Training curriculum for the DCT1. And these details can be found on the CopDend website. So what is the format of the exam? So looking firstly at part 1. So part 1 is a 3-hour paper-based exam. It consists of 150 single best answer questions. All the questions carry equal marks and there is no negative marking, and there are no trick questions. So let's look at a sample short single best answer question. So a 40-year-old woman undergoes a lateral cephalogram for orthognathic planning. On review, well-defined rounded lucent lesions are seen throughout the skull. What is the most likely diagnosis? Is it hyperparathyroidism, Langerhans cell histiocytosis, leukemia, multiple myeloma, or pituitary adenoma? So the answer to that is multiple myeloma. So looking at another sample question, a school secretary telephones your practice asking if a 14-year-old girl has attended your surgery for a dental appointment earlier that day. The school is very concerned about the whereabouts of this girl, as she is usually very reliable. What is the most appropriate response? Advise the school that no information can be disclosed. Advise the school to contact the police. Call your Defence Indemnity Society prior to confirming attendance and time. Confirm the attendance and time. Contact the child or the parents yourself. So the answer to that is A, to advise the school that no information can be disclosed. So looking now at part 2. So part 2 consists of OSCEs, or Objective Structured Clinical Examinations. And there'll be a circuit of 14 stations, which are each of 10 minutes duration. So the total time for the exam is 2.5 hours. Now, an important change to the MJDF exam is that there will be no practical skill stations included within the OSCE circuit. So, for example, in the MJDF, practical skill stations were included, such as constructing a temporary crown, demonstrating CPR on a dummy, or biopsy and suturing techniques. This doesn't mean, however, that you won't be asked about medical emergencies. These can still be incorporated within the OSCE circuit, but you won't be asked to demonstrate the practical skills. So the OSCE assessment will test the candidates on the following 7 domains. So it's applied clinical knowledge, communication, diagnosis, information gathering and information imparting, investigations and management. And each of these domains will be assessed a minimum of 5 times as you pass through the OSCE circuit. Now, this makes it a very fair assessment. So if, for example, on station 3, you feel that you've messed up on the communication, well, you're not going to fail that, because you'll have another at least 4 times to demonstrate your communication skills as you pass through the OSCE circuit. So this means there are no what we call killer stations. So if you think you haven't done well in one station, don't let that worry you. Just put that behind you, carry on to the next station. And as I say, you have a chance to prove your skills in the rest of the OSCE circuit. So here's a sample OSCE scenario. So the clinical photograph below is of a 37-year-old female who is presented to you as a new patient today. Her main concern is that her upper front teeth feel thin and the edges are rough and chipping. You should consider 1, the possible reasons for this clinical appearance, and 2, the possible treatment options available. So you'll be given this to read during your preparation, and after 2 minutes you will then enter the OSCE room. There will be 2 examiners present and they will ask you the following questions. What does the clinical photograph show? What further information do you require from the patient? What investigations would you undertake? The second examiner would then ask, what are the various treatment options for this case? The patient informed you that she has an eating disorder and it is affecting her quality of life. She does not want her partner to know about her eating disorder. What should you do in this situation? So I just want to put all of this MFDS into the context of the Miller's pyramid of clinical assessment. So I'm sure you're very familiar with the pyramid, and the bottom tier is nose, which tests your knowledge, and this is being tested by the single best answers in the part 1. The next tier is your integrated knowledge, the knows how, and again this is being tested in the part 1 with your single best answers. The next tier is the shows how, which is testing your competence, and this is being tested by the OSCEs in the part 2 of the MFDS. The top tier, the does, the performance, it's not possible to test this in an artificial situation such as an exam. This could only be done whilst you're doing your real work with a real patient and you're being assessed by your clinical supervisor. So all candidates who are taking the MFDS exam will receive constructive feedback on their performance, irrespective of whether you pass or fail. So the feedback gives you an excellent insight into your relative strengths and weaknesses in key clinical areas, and thereby offering a valuable educational component. And this is an important factor because previously you would only receive feedback if you had failed the exam and you contacted the college to find out the reasons why. And I think it's very insightful because sometimes you might think you've done very well at the communication station, but actually the feedback will show that your communication's not so good, but actually your diagnostic skills are a lot better than you thought they were. So this is indeed a valuable educational component. So how much does the exam cost? Well, it is quite a considerable amount of money at this stage in your career. So it costs £535 to sit the part 1. The part 2 costs £715, but as long as you pass the part 1 at the Royal College of Surgeons of England, you will receive a 10% reduction. So my message really would be to ensure that you've done adequate preparation and revision before you do come to sit the exam, because the financial costs are quite significant. And that's not the end of the costs. If you want to use the initials MFDS after your name, then you need to pay an annual membership fee to the college. And for the first 10 years, to be able to use those letters after your name, the annual membership fee will be £316. So I want to talk about now some of the benefits of joining the Royal College of Surgeons of England. So this is the college here. It's a very impressive facade, and it's situated at Lincoln's Inn Field, which is near Holborn, just off the Southampton Row. So it's in a very pleasant and accessible part of London. Opposite here, we have a park with tennis courts. And the building for the last few years has been undergoing extensive renovation. So the facade here will remain unchanged, but this is the back of the building, where most of the building has been demolished and is being rebuilt. This is a picture from inside which shows the demolition. So the new college is due to open in July 2021, when it will provide a new state-of-the-art building which will offer world-class learning facilities. The Hunterian Museum is certainly worth visiting. This has all been updated. There'll be excellent rooms for courses, exams, simulated learning, and there's a restaurant cafe which will also be open to the public and offers a wonderful space for socialisation and relaxation when you visit the college. So some of the other benefits, you'll have free subscriptions to the award-winning Faculty of Dental Journal, and you'll also have access to the bulletin and the annals. You get regular e-newsletters keeping you up to date with policies and developments in dentistry, access to over 1,000 free ebooks and e-journals, and access to the Funky Professor Anatomy videos. And there are also monthly webinars which are covering both professionalism and specialty-specific emerging techniques in dentistry. As I previously mentioned, you'll receive a 10% discount on your MFDS Part 2 fees. You'll receive a package of 20 MFDS Part 1 sample questions. You have access to national and regional events and courses, and you'll receive discounts on these. And you'll also have access to eDen, which is a very valuable online dental educational resource. So being a member of the college also provides you with the opportunity to meet like-minded individuals and build your professional connections and networks. And if, like me, you may decide that you wish to become a lecturer, an examiner, or a trainer, and this opens up a whole opportunity of meeting new people. And there are dedicated support systems throughout the country with the regional and specialty advisors. So where can you take the MFDS exams? So the last few months have provided very difficult times with the COVID, which has restricted the face-to-face training and assessment and delivery of exams. So the Part 1 exam has been delivered in the form of an online proctored exam, and the first online exam was on the 7th of October 2020. And it's likely that the Part 1 will continue as a remote exam. So the Part 2 will be delivered remotely in November 2020 and March 2021. The platform used will be Microsoft Teams. It will be a very similar format to the face-to-face teaching, except that obviously instead of just going to a room where you'll face the examiners, you'll go to a virtual room where you'll see the examiner, and if there's a role play or an examiner, they will be present on the screen. You will have a host who will be a member of the Royal College of Surgeon staff who will be helping you to guide you throughout the circuit in and out of the rooms. So the future deliveries of the MFDS exams is still in question, as nobody knows what will happen with the COVID pandemic. But as I said, Part 1 is most likely to remain as a remote exam, and this makes it an extremely accessible exam to both the UK and our overseas candidates. With Part 2, at the present time, we're uncertain if it will either return to face-to-face exam format or if it will continue as a remote exam. Previously, the Part 2 diets have been held in London and then other parts of the country such as Manchester or Leeds, and there have also been overseas diets in Cairo and Kuala Lumpur. But as I say, at this time things are uncertain as to the future of these diets. So these are some useful contacts, and I would say please keep looking at the website, as the dates of the exams and the way in which they're being delivered will be constantly updated on this website. Thank you for your time, and I hope you have found this useful.